And Sweden has reported the first case of a deadly variant of mPox outside of Africa. And let us stay with that story now, because a contagious variant of the mPox virus, what until recently we knew as monkeypox, has been detected outside the continent of Africa for the first time. The government in Sweden says the case is in someone infected whilst they were staying in Africa. The World Health Organization declared a public health emergency of international concern yesterday, citing the spreading of the virus in the Democratic Republic of the Congo, the DRC, and 15 other countries in Africa. Let's talk now to Dr. Bharat Pankania, who's Senior Clinical Lecturer in Communicable Diseases at the University of Exeter. You may remember we spoke to Dr. Pankania many times during the COVID outbreak. It's good to speak to you again. Can I ask you, first of all, to tell us about the decision to declare this as a potential global risk? Why has the WHO made this decision? And should we be surprised at the warning that there will be more cases in Europe?
So we've got an outbreak in Africa in several countries and lots of cases. And when we've got an outbreak of that ilk, many people, many countries, and many illnesses, and of course deaths as well, it is a good measure to say we've got an international outbreak and we got to act. So the act of saying we've got a health emergency opens up gates for funding, release of vaccines, use of vaccines. And is it surprising that we've now got a case in Sweden? No, not at all. Because I've said this before, whatever happens in one part of the world will inevitably happen in other parts of the world, because now we are so interlinked and there's a lot of people moving around.
The question, though, with this illness is presumably it is a disease that's spread through close human contact. I mean, in the past, for instance, people have been warned about sexual contact and so on. Therefore, once this first case is from somebody who got it in Africa, presumably the concern is about whether or not people start to get it in Europe. In other words, they get it from each other in Europe at some point.
So that would happen if we had a large number of people who had this infection and were amongst us, but we were unaware of them. So, for example, the United Kingdom Health Security Agency will be setting up, how do we look for these people? What are the signs and symptoms? And how do we isolate them? Because just before you have the signs and symptoms of the illness, you can be infectious. And that is the concern, that somebody appearing normal can also be infectious. And therefore, that thing of where have you been? Could you be potentially incubating the illness? And therefore, you need to be removed from circulation. Those are the thoughts that United Kingdom Health Security Agency will be are addressing right now.
What are the symptoms and what are the risks from mPox?
So the symptoms will start off like flu-like symptoms: fever, headache, back pain, muscle aches. And then this peculiar rash starts. It's little vesicles, little pearls, fluid-filled sacs. And these little vesicles, a bit like chickenpox, but much more extensive, all over the body, hands, soles of the feet, and also in the mouth. And then most people will recover, but it is more serious illness in the younger age group, and of course in those people who are immune suppressed. And then think about this: in Africa, there are a lot of people who have HIV, untreated HIV, and they are immune suppressed, and they will have more severe illness.
So when we talk about fatalities, it is more likely that people are at risk of death if they have pre-existing health conditions, if they already have HIV, or if their immune system is in some way suppressed.
Indeed so. And also, when we talk about fatalities, it's so important that what happens in Africa does not necessarily mean will also happen in, for example, Europe or United Kingdom, because we have a much better healthcare system. So I expect that case fatality in Europe will be a lot lower than the case fatality is in, say, Democratic Republic of Congo.
One last question, if I may. We were calling it monkeypox. We're now calling it mPox. Why the change?
Oh, that's a good one, because it's not necessarily from monkeys. So we've identified that the reservoir for the virus is probably rodents. So it is much better to call it mPox, only because we used to call it monkeypox, but it's got nothing to do with monkeys. It's most probably rodents that carry the mPox virus.
Dr. Bharat Pankhania at the University of Exeter, thank you very much as ever for talking to us.